Out of the 103 million shillings, that's the same amount of money. If you spread it among 100 doctors, you would get a very big change in the quality of care.
More than 90% of Ugandans live in rural areas, but only 10% of doctors work in these areas. While medical workers in urban areas complain of poor working conditions and remuneration, it is usually worse for the rural practitioners, and it is no wonder the numbers there are few. They recommend that attraction and retention of health workers working for government upcountry should be the major focus in the allocation of the Ministry of Health 2012-2013 budget.
This is to encourage health workers to take up the posts in the upcountry stations.
Starting from this year, we had prioritized infrastructure improvement, and massively, within like 2 to 3 years, about 90% of the infrastructure in the country will be improved, of the hospitals.
Another issue is that of pay. The association now recommends that the Ministry of Health should shift its focus away from lobbying for increased salaries to lobbying for increased allowances. They ask that the consolidated health allowance which health workers receive monthly be increased to 250,000 for low cadre and 500,000 for senior cadre staff.
In the past, we have been pushing for salaries to be increased, but that we have found cannot happen. But this looks like something that is likely to happen this financial year.
I agree with them that we have taken longer without revising the figures, and then we are in a budgeting process.
While other associations have found strikes as a more reliable option, the association says strikes and demonstrations are not part of their plan. If their recommendations are not qualified, they will go back to the round table.
We are not going to instigate health workers to strike, because the public suffers most when that happens. But unfortunately, people are pushed against the wall, and we will have more people leaving the sector.
Other issues that were discussed by the two parties were that government reconsiders sponsoring postgraduate doctors working in clinical areas like surgery, obstetrics and gynecology, pediatrics and the like, and that the conditions of medical students be improved, starting with them also vaccinated against hepatitis B. Josephine Karunji, NTV.